Hello, my name is Kiran Bains and I'm your examiner for this station. This is Michelle, your role player. Please could you take a focused developmental history?
So hello Michelle, I'm Kate. I'm one of the doctors here today.
Hi.
Is it okay to call you Michelle?
Yeah.
Perfect. And do you want to tell me sort of what's brought you here and how you've sort of been referred to come see me today?
Yeah, so I've brought my little boy in today just because the health visitors were worried about his development.
Okay.
It's my first child, so I'm not really sure what to expect, to be honest.
Okay. And before the health visitor had concerns, had you had any concerns of your own that sort of prompted you to go to the health visitor, or was it just picked up on a routine check?
It was just, picked up really on a routine check.
Okay. And what sort of things had the health visitor said that she's worried about to you?
So he's only just started standing. He's not walking on his own yet. He kind of like walks on the furniture holding on to stuff.
Okay.
And he doesn't really say many words.
Okay. So what we might do then is just explore a bit more of that in detail, if that's okay.
Yeah, of course, yeah.
Yeah, so your little one's 18 months old now, is that right? Yeah. So thinking about back to the start, was he born at the right time, or was he early, or was he late?
No, yeah, he was born on time, just a day after.
A day after.
Yeah.
Was there any issues in your pregnancy at all?
No.
No, so your scans were all normal and they were happy about your health?
Yeah.
Okay. And when he was born, was it a normal delivery, or was it sort of any sort of chaos and emergencies going on at that time?
No, it was just a normal delivery.
Normal delivery. And did he come with you straight after birth, or did he need to go to the special baby unit?
No, I think we went home the next morning.
The next morning. Good. And sort of from then until now, has there been any sort of health concerns or any reason he's needed to go into hospital for antibiotics, or any additional sort of investigations that have been done?
No, I think he had antibiotics for his ears, but it was only for like a week or something.
Okay.
But yeah, he's been fine.
He's been fine, so no sort of significant illnesses in that time?
No.
Okay, fine. And again, going back to the start, can you remember when your little one sort of sat up for the first time?
It was, I think, just before his first birthday, maybe.
Yeah.
Yeah.
Okay. And do you think, sort of thinking about when he did sit up at 1, was that sat up at 1 but sort of being really unsteady and falling back, or was that sort of sat up at 1 and able to keep himself sat up and maybe play at the same time?
No, I think he was still able to play on his own by that age. Yeah.
So really sort of sturdily sitting up. Okay. And does he crawl at all?
He's never really crawled.
Okay.
He went from bum shuffling to then like pulling himself up on the furniture.
Okay. And when do you think that time was?
That was recently, actually. So, a couple of months ago.
A couple of months ago. So he sort of sat up at 1, and then he sort of gone around furniture in the last few months.
Yeah.
Okay. And when he's going around that furniture, does he ever let go and sort of try and take a few steps on his own?
It hasn't been, no.
Okay.
No, I've been trying to encourage him, but he's really holding on.
Yeah, I can imagine. Okay. And have you noticed sort of any episodes where he seems to need something to kind of walk up, or when he's trying to hold himself up and walk around furniture, have you noticed a difference of a way he sort of gets up to standing, or does it just look like any other child?
I've not really noticed, to be honest.
No, that's fine. Okie doke. And thinking about whether you've noticed if he uses one side of his body more than the other at all?
I haven't.
No, that's fine. Okay. And now thinking, you mentioned is your first child.
Yeah.
Is there any conditions at all that run in your family?
My brother has Crohn's, but apart from that, I don't think there's anything.
Okay. And what about his dad's family?
No,
so everyone's well, and no one had any concerns about their development at all?
No.
Okay. And thinking again about your little one, have you noticed sort of speech-wise if he's making any noises or saying any words?
So he can say mama and dada.
Yeah.
And he says my sister's name, he says Anna.
Okay.
But apart from that, he doesn't really say anything else.
Okay. And how old do you think was he when he started to make those sort of names and noises?
Probably around just after his first birthday.
Okay. And in the last 6 months, do you think he's had any new words, or has he just hovered around those 3 words?
Yeah, he doesn't seem to be progressing. He doesn't really say many new words.
Okay. Can he point at any animals or any objects or parts of his body?
No.
Okay. And more on sort of the speech and language side of things, how do you know if he wants a drink, for example? What would he do?
He'd point, or he makes a noise, and I don't know, just because I'm his mum, I just kind of know what he wants, if that makes sense.
Yeah, no, that makes sense. Does he go to anyone else, like a nursery provider or a childminder, or stay with any of the family members?
He stays with my mum sometimes, yeah.
Okay, and how does he communicate with her?
The same way, but I don't always know if she gets what he wants, and he can get frustrated or upset.
Okay, that must be quite difficult then.
Yeah, I think it's hard for her sometimes.
Yeah, okay. And have you had his hearing checked at all?
So he had a hearing test when he was born, I think, but as far as I know, everything was fine with that.
Okay, so you never needed any additional appointments for that hearing?
No.
Okay, and what about his vision?
As far as I know, it seems okay. He sees me when I'm in the room and follows me. He like looks at the dog and stuff. So
okay. And do you think ever noticed like a squint, or that maybe he's looking past you, or any concerns?
Not that I've noticed. No.
And if you call his name, would he turn and look at you?
He would, yeah.
Yeah. Okay, perfect. And does he seem to sort of look at the television an appropriate distance, or do you find that he's really close to television when he's watching it? If he watches it.
Yeah, he has an iPad, and sometimes he does hold it quite close, but I don't think that's due to him not being able to see it. I think that's just
maybe more of a behaviour
thing.
Okay. And socially wise, can you remember when he started to smile? This might have been some time ago.
Yeah, I know he was definitely smiling around 3 months, because it was at my birthday, and I've got pictures of him smiling.
Oh, that's nice.
Yeah.
And do you notice that he laughs, or sort of would follow sort of social cues about laughing, or be sad if you're sad?
Yeah, I remember him laughing about 6 months, around that time.
Yeah. Okay. And does he sort of wave if someone's if you say, oh, Grandma's going now and Anna's going now, and you wave, would he wave back?
Yeah, he does that now.
Does he?
He waves and he claps and stuff.
Oh, lovely. Yeah. And does he say bye at all, or wave bye?
He'll wave, he doesn't say bye.
Okay. And sort of thinking about when you're all sort of sat eating dinner, how does he eat dinner, or do you still feed him?
Yeah, I'm still kind of feeding him, really.
Okay. If you put any crisps out, or if you put a spoon out, would he try and pick it up and sort of mouth it, or would he just hold it?
He does try, but he doesn't really get it in his mouth. It just goes everywhere.
Okay.
So sometimes it's just easier if I feed him.
Yeah. No, it probably would be. Would he? Because you said that although he would make a mess with the spoon, would he be interested in hold it up and sort of try and get it to his mouth?
It's definitely holding it, and it kind of attempts, but it's. Most of the time I just give him stuff that he can just, pick up on his own with his own hands.
Okay. And puts things to his mouth, does he?
Yeah.
Okay. Does he throw things away still? So if you gave him like something to hold, would he throw it away, or would he keep it and keep interested in it?
He probably would. Yeah, he does throw things away sometimes when I give them.
Okay.
Yeah.
Okay. And does he look for where they've gone, or would he just throw it and that'd be done?
I don't think he'd look for it. No.
Okay. No, that's fine. Okay. And you mentioned he's tried the spoon and he's tried bringing other things. Does he have finger food commonly?
Yeah. So when I first started weaning, it was a bit of a struggle, to be honest. I don't know if he was just like fussy with what I was giving him. I did like pureed foods.
Yeah.
So now I've tried to give him a little bit more solid stuff with the finger stuffs that he can eat, but I still do give him a lot of pureed things.
A lot of puree. Okay. Any issues with his swallow that you've been concerned about?
No, not that I've noticed.
No. Okay, fine. And thinking about does he go to any play groups or any sort of baby groups at all, or see any of the children?
I mean, sometimes I take him to a play group, but I find it a bit overwhelming.
Okay.
I feel like all the other parents seem to be doing more with their child, and they're a lot more confident. So yeah, sometimes it just feels a bit hard. Okay.
Maybe looking at sort of comparison and things, it can be difficult, but all children do things differently, don't they?
Yeah.
And when you are at groups, does he seem to notice other children?
He does notice them, but he kind of sticks with me.
Yeah. Okay, that's fine. Okay. And any other sort of concerns or any thoughts that you've had about him, or anything else you wanted to explore today?
Not really. They mentioned that he had a bit of a flat head at the back.
Okay.
But no one's mentioned anything else about that. So
when was that noticed?
When the health visitor started coming to see him, she mentioned something, but it's never been mentioned since. So.
Okay. And is it something that you've still noticed now he's grown older, or is it something that was noticed really when he was a baby?
Yeah, I've not noticed it as much.
Okay.
as much recently.
Okay, and any scans that he's ever had of his head? I think you said before you weren't sure of any investigations.
No,
but
I don't.
just
He's never
wondered.
had a scan of his head, I don't think.
Okay, all right. Well, thank you so much for talking to me today. It's obviously sounded like a difficult journey for you, but hopefully we can get things sort of progressing and we can make a plan going forward. Is that all right?
Yeah, that sounds good. Thank you.
All right, thank you so much.